Welcome to the Healthy Body. Dr. Alex here. Today, we're diving into some of the most common yet often confusing health issues that affect both men and women, from vaginal dryness and changes related to menopause, to blood in the urine, and even kidney stones. These are topics many people feel uncomfortable talking about, yet they have a huge impact on our quality of life. My goal today is to bring you clarity, reassurance, and practical solutions backed by science. Before we get into the details, if you enjoy learning practical, science-backed health advice that helps you feel more confident and in control of your well-being, I'd love for you to hit that subscribe button. That way, you'll always have access to new strategies and tools for living healthier, stronger, and longer. Let's begin with a very common concern: vaginal dryness. Many women and their partners notice changes in intimacy that can be confusing or even painful. Imagine this. You and your partner are excited, the mood is right, but once things progress, discomfort shows up because there just isn't enough natural lubrication. This isn't about not being turned on, and it's not about attraction. The truth is, lubrication changes are strongly influenced by hormones, age, medications, and even genetics. For women in their 40s, like in the example we heard, the body may be approaching what's known as perimenopause, the years leading up to menopause. On average, menopause occurs around age 51, but the hormonal changes can start as early as 10 years before. Estrogen levels fluctuate wildly during this time, sometimes high, sometimes low, but ultimately the trend is downward. Estrogen isn't just about reproduction. It plays a vital role in maintaining healthy vaginal tissue, elasticity, and moisture. When estrogen declines, the tissues become thinner and drier. This is called the genitourinary syndrome of menopause, and it affects up to 80% of women after menopause. Now, not every woman experiences dryness in the same way. Some may notice it early, some much later, and the severity varies. It's not a sign of something wrong, but it can certainly create challenges in intimacy and daily comfort. So what can be done? The first step is lubrication. Think of lubricants as giving your body an extra helping hand when natural moisture is limited. There are three main types: water-based, silicone-based, and oil-based. Water-based lubricants are easy to find at any pharmacy, but they evaporate quickly, which means you'll often need to reapply during intimacy. Silicone-based lubricants last longer and provide a smooth, slippery texture that many people appreciate, though they shouldn't be used with silicone-based toys. Oil-based lubricants, such as those made with coconut or olive oil, can feel luxurious and long-lasting, but they may stain fabrics and should not be used with condoms, since they can break down latex. A useful tip: always do a patch test on your arm before using any new product on sensitive tissues. It's a simple way to prevent allergic reactions. If lubricants aren't enough, vaginal moisturizers are another option. Just like applying lotion to your skin, these are applied inside the vagina every day or every few days to keep the tissues hydrated. They often contain hyaluronic acid, the same ingredient found in many facial moisturizers, to lock in moisture and promote comfort even outside of sexual activity. The most effective option, however, is local vaginal estrogen therapy. Unlike systemic hormone replacement, vaginal estrogen delivers tiny doses directly to the tissues that need it. It comes in creams, small tablets known as suppositories, or even a flexible ring that stays in place for about 3 months. These therapies are incredibly safe because the estrogen stays mostly localized, with only minimal absorption into the bloodstream. Research shows that these treatments do not increase the risk of breast or ovarian cancer. For many women, vaginal estrogen restores comfort, natural lubrication, and intimacy in a way that feels life-changing. If your partner is experiencing dryness, approach the conversation gently and with empathy. Offering to explore lubricants together or going with them to a doctor's appointment can make them feel supported and understood. Now let's move to another common concern: pink or reddish urine. Seeing blood in your urine can be alarming, and rightly so. While not every case is serious, this is not something to ignore or take a wait-and-see approach with. Blood in the urine, also called hematuria, can result from infections, kidney stones, or even bladder or kidney cancer. Although cancer is less common, accounting for about 15% of cases, it is important to rule it out quickly, because bladder cancer in particular can grow aggressively. So what happens if you or someone you know sees blood in their urine? Doctors typically start with a urinalysis to look for red blood cells, followed by a urine culture to check for infection. Imaging studies such as an ultrasound or CT scan may also be ordered to get a closer look at the kidneys. In some cases, a procedure called cystoscopy is recommended. This involves using a small camera to look inside the bladder. You might wonder, why not just rely on scans or MRIs? The reason is that the bladder changes shape depending on whether it's full or empty, and folds in the lining can look misleading on imaging. A cystoscopy provides a direct, clear view of the bladder lining, which is the best way to rule out cancer. I want to emphasize, though, that many times the cause is harmless, such as irritation from an enlarged prostate in men or vaginal dryness in women. Still, it's always best to investigate early, because time matters. Now let's shift to kidney stones. If you've ever known someone who had one, you know how painful they can be. In fact, kidney stone pain is often compared to the intensity of childbirth. And yes, both men and women can develop them. Having a family history, like the example we heard, increases your risk significantly. So what exactly are kidney stones? Think of them as little crystals that form in the kidneys when certain substances in the urine, such as calcium, oxalate, or uric acid, become too concentrated. Over time, they clump together and form hard stones that can block the flow of urine and cause intense pain. Fortunately, there are very practical ways to reduce your risk. Number 1. Hydration. Aim for 2 to 3 liters of fluid each day. Keeping your urine dilute makes it harder for stones to form. A simple check is the color of your urine. Pale yellow usually means you're hydrated enough. Number 2. Increase citrate in your diet. Citrate is a natural inhibitor of stone formation. You can get it from citrus fruits like lemons, limes, and oranges. Even adding lemon slices to your water helps. Believe it or not, some sugar-free drink mixes like Crystal Light also contain citrate, which can be surprisingly effective. Number 3. Reduce salt intake. High sodium levels in the diet make the kidneys release more calcium into the urine, which increases the risk of stones. Try limiting processed foods, canned soups, and restaurant meals, which are typically loaded with salt. Number 4. Limit high oxalate foods. Oxalates are compounds that bind with calcium to form stones. Foods like spinach, rhubarb, kale, and certain nuts are very high in oxalates. You don't have to eliminate them entirely, but moderation is key. Number 5. Moderate your protein intake. Diets extremely high in red meat and certain proteins can contribute to uric acid stones. Balance is always best. And here's an important myth buster. Don't cut calcium completely. Many people think avoiding calcium prevents stones, but in reality, normal calcium intake actually helps by binding with oxalates in the digestive tract before they reach the kidneys. The key is balance. Not too little, not too much. If you have a strong family history, your doctor may recommend a 24-hour urine test, which measures the exact substances in your urine over the course of a day. This helps identify your personal risk factors and allows for tailored prevention strategies. Kidney stone pain can be excruciating. Patients often can't sit still, pacing or writhing in agony. But with prevention and medical support, many people can avoid this ordeal altogether. We've covered quite a lot today: vaginal dryness and menopause, the importance of evaluating blood in the urine, and practical steps for preventing kidney stones. Each of these topics highlights how interconnected our health is, and how awareness can empower us to take action before problems escalate. If you've found this information helpful so far, let me gently remind you to subscribe to The Healthy Body. Subscribing ensures you won't miss upcoming videos where we'll continue to explore simple, evidence-based strategies for improving your energy, resilience, and overall well-being. As we wrap up, remember this: health challenges like dryness, urinary changes, or kidney stones are not personal failures. They are part of the human experience, and there are solutions. With the right knowledge and support, you can move through these challenges with confidence. Thank you for spending this time with me today. If you enjoyed this video and want to continue learning ways to protect and enhance your health, subscribing is the perfect next step. Together, we'll keep building the tools you need for a healthier, happier life.